Laser vision correction is a visual event of a lifetime. For over a decade, LASIK has been considered a very safe and a very effective option to lessen your dependence on glasses, even contacts. At Dishler Laser Institute, there's an emphasis on education. Making an informed decision and preparing you for LASIK are the keys to a successful LASIK experience. Dr. John Dishler has personally performed over 56,000 LASIK procedures, making him the most experienced all-laser LASIK surgeon in Denver, really the entire state. And he's joining us this morning with an optometrist, Dr. Megan Petraitis. Now, she's assisted Dr. Dishler in his clinic for over 6 years with LASIK exams and consultations. She educates refractive surgery, and she talks to the patients on how the consultation is unique at Dishler Laser. It's good to see you both.
Good morning, Denise.
So what are the benefits, Dr. John, of having an ophthalmologist and also an optometrist working side by side in the same place?
It has worked out so well over my whole career. In fact, I mean, here we have Megan, who's an optometrist, one of the two that are at our office, and we work as a team together, and she also works with all these referring optometrists. It's so great for patients that have their own primary eye care doctor, who's usually their optometrist, that can work with them and help them in their pre- and post-operative care for having LASIK. They come to us for any expertise and for special testing we can do, as well as, of course, doing the procedure, and then they can go back to their primary care doctor. It doesn't cost them anymore. It's very efficient. People feel very comfortable. We try to make that just seamless for them.
I've always heard about the outstanding customer service you have. You've been on the show for over 8 years, so it's just another way to provide for the customer. Now, what's the primary objective when you have a LASIK consultation?
Well, the consultation is both for the patient, the prospective patient, to learn about the surgery, and also for us to learn about the patient so that we can help them to decide whether they're a good candidate for this, give them reasonable expectations as to what their outcomes are going to be. And most importantly, people need to understand that they're not obligated to go forward with anything. There's no high pressure or any of that. It's sort of a meet and greet. And in fact, we've taken that one step further. It's kind of exciting. We're going to talk about that today. But we now have an iPad app, and Megan's going to demonstrate that a little bit for you later. And it shows just how we can help patients understand more about their eyes and LASIK and that sort of thing. And for people who don't even want to come into the office, we can actually, if they just give us their email address, we can just send them all kinds of interesting information right off of this app so they can begin to educate themselves before they even meet us in person.
See, again, it goes back to that customer service. That's outstanding. And if you're watching and call today, mention Colorado & Company, and you get to save $300 off all custom, all laser LASIK. I'll tell you more about that in just moments. But Dr. Megan, let's talk about what you want people to take away, at least 3 steps when they have that consultation, because our viewers do. They like to compare and they like to shop.
They sure do. I think it's one of the most common questions I get. You know, Dr. Megan, what is it that sets you apart from LASIK XYZ down the street? And I usually try and tell patients to take away 3 things. You want a good surgeon, you want good technology, and you want a good feeling. A good surgeon, someone that's had a lot of experience. You know, Dr. Dishler's done over 56,000 LASIK surgeries at this point. Ask to see the statistics and the enhancement rates. You want good technology. Of course, you're looking for bladeless, for custom procedure to ensure good outcomes. And then lastly, a good feeling. You want to leave well educated, making sure your questions are answered and that you feel comfortable asking your doctor questions, you know, at post-op and things like that.
303-793-3000. That's the number to call right now and make that consultation. And I've heard from many of your patients, there is someone there that actually holds their hand during the procedure if they get nervous. What is your philosophy? How do you make everyone feel so satisfied and so comfortable in your office?
Well, people have to feel comfortable with us and that we're legit and we're going to take good care of them, and that we also have the technical expertise to provide them the care that they want. And, you know, Megan's mentioned some of those things, like our all bladeless approach. But our goal is to both provide the professional care as well as in a very comfortable setting, because let's face it, everybody's nervous about having anything done, and we want to make this as comfortable for people and as easy for them as possible.
So Dr. Megan, again, the technology you have is outstanding. You want to educate the patient. What do you have?
So when I first started 6 years ago and we did consultations, I actually used this piece of paper eye diagram to do everything. The last maybe 6 months, we've been using this iPad app to do our consultations.
And we have it up here too, so you're going to walk us through.
So I'll go through some things. Most people that are wearing glasses and contact lenses are nearsighted, so we'll start with that. Nearsightedness basically just means your eye is a little bit too long from front to back. Here's an eye with no nearsightedness. You can see it's a little more compact. And then the nearsighted eye, when light comes in to focus, unfortunately that light's focusing short of where we want it to focus back here. So to correct for that, if we flatten the shape of the cornea just a little bit, when light hits a flatter surface, it bends longer, and that's how we get the light to focus in the back of the eye. This little video shows you here the laser light is flattening the cornea, and boom, the light focuses back there nice and clear.
Cool is that?
Yeah. We can talk a little bit about the actual LASIK procedure if you'd like to.
Yes, can you tell me the difference also between LASIK bladed and LASIK bladeless?
Of course,
I hear that, but I don't know exactly.
This is one of my favorite videos. So 20 years ago, we were doing LASIK surgery with a blade, and I'll show you that video here. It's basically taking a cigar cutter, is what I think it looks like, and placing it on the cornea. This blade would slice through, make the corneal flap, and then that blade or that flap would get lifted. Eventually a laser would reshape the eye and do the myopic or nearsighted correction like we talked about, and then that flap would get put back down. But there are a lot of complications that stemmed from the bladed procedure, and in 2001 was when we first started using then a laser to make the flap, and Dr. Dishler was one of the first surgeons in Denver to do the all laser method. There is something that touches the eye during that procedure, nothing near as scary as what you just saw. There's this little cone that comes down and sits on the cornea. It's curved just like a little contact lens would be.
That's it?
Yep. Laser energy enters the cornea, and here's what's happening there. This is pretty neat. As the laser energy enters the cornea, it's making this little bubble layer just right under the surface.
Right.
And that's what's separating the flap tissue. And then takes 15 seconds. It's really fast. The patient doesn't feel anything.
That's
it? That's it. They just see
Wow.
light dancing around. And then again, that flap gets lifted, and then a second laser takes over and reshapes the eye. But
What
surgery itself,
amazing technology.
Yeah.
Dr. Dishler, how long does LASIK last? Will you have to have the procedure over and over again?
For most people, it lasts the rest of their life. It's permanent. There's a small percentage of people, and in our practice, it's like less than 1% that need to have it done a second time, but usually we know that within the first year or two. But for most people, they don't need it done. We've been doing this just almost 20 years. We did our first LASIK, and there's occasionally people that need a little touch-up or their eyes change naturally, but by and large it's a permanent type of correction. And I'd like to also mention that this bladed LASIK, which we don't do and haven't done for over a decade now, but many laser centers still do use that method, and so people need to ask, if they're looking at LASIK, that's a big difference between the two, and they really should ask for the all blade-free, all laser method, because it's more accurate, the results are better, it's more comfortable for the patients, it's safer.
Obviously, you have the technology and the experience, and thank you for that demonstration. It was wonderful. Again, choosing Dr. Dishler, you'll receive a high standard of care at the best value and a local surgeon that you can trust. Dishler Laser Institute is offering an exclusive Colorado & Company special just for you when you schedule your LASIK surgery by July 31st. You'll save $300 off Dr. John Dishler's lowest guaranteed price for custom all laser LASIK. Your consultation is free, and special financing, yes, that's available. Some restrictions do apply, including credit approval. Just call 303-793-3000 for more details. You can also go to Dishler.com. That's Dishler.com, and the Dishler Laser Institute paid for the segment.